What are the different types of kidney disease in cats?
Well, you can have infections. You can have actual kidney stones. That's pretty common, actually, in old kitties. You can have toxic insult, like with the melamine in the cat food.
Okay.
That caused a lot of animals to die of kidney failure, but it also caused it caused acute kidney failure or acute renal failure. But those animals that recovered had chronic kidney damage, which is probably going to get worse over time. And, all old kitties, it seems, practically all of them anyway, do develop renal failure with age. Now, I have a theory about that, and the theory has to do with the feline distemper virus.
Okay.
And it's our bad habit of vaccinating cats every year for something they don't need. And consequently, the kidney, the virus itself that goes into the vaccine is grown on what they call Crandall-Reese kidney cells, and they're cat kidney cells. So when those viruses are filtered, some of the kitty proteins get in with it, and then you inject it into the cat, and the cat will make antibodies against it and cause chronic inflammation. It tends to make antibodies to things like red blood cells and particularly connective tissue. There's a lot of connective tissue in the kidney, and so you're setting up a situation where you have each vaccine creates more and more antibodies, which creates more and more inflammation as those antibodies bind with the kidney tissue.
Okay.
So you set up a chronic low-grade inflammation in the kidneys, and if you do that every year, the kidneys can just only take so much of that, but the inflammation starts to run its course and leave scar tissue in its wake, and you have enough scar tissue, and then you have no functional kidney tissue left. So that's the most common thing I see is the chronic renal failure from years of dry food that's caused a burden on the kidneys, or vaccines that cause chronic inflammation. But it's kind of divided into acute and chronic would be things like inflammation and kidney stones and things like that, and acute would be things like toxins and infections.
Okay.
I guess I should have said that first.
No, that's okay. That's why we're recording it.
Yes, because then you can cut and paste and make it logical.
That's right. Okay, so chronic renal failure.
There's a lot of wacky things that can happen to the kidneys, but those are the big ones.
Okay. So are there ways to prevent kidney disease in your cat? I mean, obviously from what you just said, I could conclude to avoid the vaccination. Right.
Now, distemper will kill a cat, and it'll especially kill a kitten. So, I recommend that you get the first couple of 2, 3 distemper vaccines when they're kittens, because it's a chronic disease. But it's a very common disease. You'll bring it. It's a parvovirus. You'll bring it in on your shoes. I had a friend who did not vaccinate and lost like 11 cats and all the kittens in her.
Oh my gosh.
In her facility. So it was because the worker was not careful about changing shoes when she came in. So I vaccinate the kittens for distemper, but they don't ever need a booster. That vaccine lasts from 8 to 15 years or more, which is pretty much a cat's lifetime, and it's really a disease of kittens. And if you're a cat and you've lived a normal life, even if you've lived it indoors, you've been exposed to that parvovirus over and over and over again. So it produces very long-lasting, and I suspect lifetime immunity. And they never need another distemper shot. And since that's the one is feline panleukopenia, technically. I should have said that first too, huh? but you know, once they have immunity to it, the chances of ever getting severe disease from it is just pretty much nothing.
Okay. Well, that's good. I'm so thankful that I had this conversation with you via email before I took Charlie and Trigan. Because I know that my vet would have scared me into it. I know that I would have allowed that to happen, and when I don't have a good gut feeling about it, then that's when I start to question it. So
yeah,
I'm glad we're.
Well, you know, and that's Mike Lappett's been presenting this information at conferences for several years now. That I'm sure the Purdue people are well aware of it. But vets, you know, when you go to a conference and you're getting your continuing education, this is a personal peeve of mine, so you have to listen. You know, vets make more money off of dogs. Dogs are bigger.
Yeah.
They take bigger pills. They eat bigger food. You know, if you're a vet in small animal practice, you're going to probably go to the lectures that are something that you're going to be able to use and make money with, and that's going to be the dog stuff. So most vets aren't cat people. They're not. They don't grok with cats. You know what I mean?
Yeah.
I have a simpatico with cats. I've worked primarily with cats. I understand them. You know, I can see, I can feel, I can get it. You know, get it on a really soul intuitive kind of level. What's going on? You know, and most vets are not that comfortable with cats.
Right.
So, and they certainly don't know this research, even though it's been out there for many years. You know, it's not just common knowledge, and there's always controversy about vaccines, and most vets have gone, well, I wouldn't say most, everybody recommends, all the experts recommend that you go to at least every 3 years, if that, and the data is very strong in dogs, and it's pretty good in cats, that, you know, you don't need to be revaccinating these guys for all these diseases that, you know, aren't really a threat. And but you know, many vets are still tied to the vaccine income.
Right.
And the thing says on the label, give it every year, so they think that there's some great liability, that it's the standard of practice. There's a lot of reasons. I went to a meeting once where we talked about vaccines, and it was just amazing. And the place was packed. It was vets from all over the Front Range at Denver, Boulder, Fort Collins, the whole area, and it was up at Colorado State. And everybody that commented, it was amazing how many different ways that individual veterinarians found to say it's the money. But that is what it came down to with every single one of them.
Wow.
It came down to the income, you know, and that should have started in 1994 when this started to come out, and the vaccine sarcomas and things started to be, all that started to be figured out. In 1994 was the first article published about it. And, you know, so vets have had almost 20 years to figure out a way to replace that income with something else. Now, some have gotten very clever and have done, but others are just like, well, not until they make me.
Yeah.
You know? And so, you know, in so many things, and maybe you shouldn't quote me on this, but the old guys just need to die. They just need to die off, and then the younger vets will take over, and they will know more, and they will be more concerned with these issues.
Yes.
The old guys, they're going to do it their way, and hell with research and science, and forget it. You know, I've always done it this way, and everybody's done just fine. Well, you know, the animals that get sick for that vaccine or get cancer for that vaccine, they don't go back to that vet.
Yeah.
You know, but there's no way to keep track of that. You
Right.
know, so it's just a torturous thing to watch. You know, the profession still floundering around, and the American Animal Hospital Association just came out with a whole new thing about vaccines and saying, you know, really, we know they last 3 years. In fact, we know they last 5 years. But they refrain from recommending that we go to an every 5-year schedule, because this just won't do it.
Yeah. Gosh. Well, I will not quote you on that, but I can't help but tell you that.
I want them all to die.
I can't tell you. I completely agree. I actually take my cats to Casey Cat Clinic, so it's only cats. But
oh, that's good, because those vets that run only cat clinics tend to be a little better about it.
Yes, but yeah, I'm still struggling with them, obviously, and that's why I reached out to you about the vaccination thing. But my mom takes her German Shepherds. She used to take all of her animals, but now just takes her dogs to a guy in Kansas City that's been here forever, you know, and the way that he approaches things, like my mom's German Shepherd Tucker has degenerative disc disease, and he basically just told my mom, you know, when you can't stand it anymore, put him down. And I'm like, Mom, like, let's try acupuncture, let's try something, like, what? And so, you know, we tried acupuncture and he's doing great.
Fantastic.
But anyway, so yeah, I can't agree with you more, because he's just like so quick to shoot him up with something. And when my Rags was 14 years old, I took him in at that point I was 24, so I was in college, or I was out of college, but in master's school, and I took him in, he opened up his mouth, took it, and Rags had never had a dental, so at 14 years old, and he took his thumbnail, I will never forget this for as long as I live, and he popped a huge chunk of tartar off of the back of Rags's teeth. Like, first of all, I'm thinking, why are you putting your fingernail that's full of bacteria in my cat's mouth? And then when he popped off the tartar, I was like, that's pretty bad, right? Shouldn't I do something about that? And he's like, no, all cats lose their teeth. It will be fine. And I started crying. And I was like, you don't understand, you know, how important this cat is to me. I really need to know, is this okay? And then all of a sudden he did like a completely new overhauled check of him. And that was when I sought out the cat vet only place.
Yeah. Well, I have to say I've done thousands of thumbnail dentistries. You know, if I could get the worst of the tartar off and save the cat an anesthesia, you know, put it off 6 months, I'm happy to do that. But, you know, at least he looked.
Yes, that's true. That's true. Well, I mean, the first thing that happened when we got to the cat clinic was he needed a dental.
Yeah. Yeah.
So.
Yeah. I used to chunk the tartar. If you think there's no bacteria in the cat's mouth, the bacteria on my thumbnail is not going to add anything at all to that. But I had a 20-year-old Siamese come in, and he had that kind of tartar that looks like it'll just come off in one big chunk, and it'll all be good, and it'll be bright, shining white underneath there. And I pulled it off, and the whole crown of the tooth came off.
Oof.
It's like, okay, so we'll see you tomorrow morning. And the cat was 20 years old.
Wow.
And I was like, oh, shit, what did I do to myself? And the cat did great.
Oh, good.
Fabulous. You know, but, you know, you've got to keep up on this stuff. You really do. And especially, you know, the more purebred the cat is, and I find that, like, Abyssinians, especially, and a few of the breeds like that, and redheads, your calicos and your orange tabby, they tend to have a lot more inflammation, more than tartar.
Oh.
But Abby's, you know, if you see an Abyssinian with teeth that's more than 4 years old, that's a rare cat.
Wow.
Because they have such terrible dental disease. They're, you know, you start pulling teeth on them when they're 2.
Wow, that's crazy. Yeah, I'm pretty sure my cats are gonna.
It's the genetics, and it's just, some cats make more tartar and some cats make more inflammation, and if you've got a cat that makes both, I had a cat that was rescued as a kitten. He was only 3 weeks old, sick as a dog, and I pulled all his teeth when he was 15 months old.
Wow.
Now, he's only had those teeth for 6 or 7 months,
Yeah.
but they were so terrible. It was like pulling them out of butter. It was just ridiculous.
Wow. God, that's crazy.
Well, they're not, flossing with feathers and fur anymore. It's just not happening.
Right. My one of my cats, he loves to bite on metal, and his teeth look better than my other cats. But what he does is he bites on metal with his back teeth, almost like he's, trying to clean them.
Chewing on it.
Yeah. So, anyway, it's curious. And I let him do it because I figure he knows what he's doing.
Yeah. I mean, you still got to have a checkup and everything, because he could crack a tooth at some point.
Oh, yeah. I'm sure we're going to have dentals this year based on their tartar level, but... Anyway, I'm sorry to get off on a tangent.
Oh, that's okay.
The next question is, what are some signs of kidney disease?
Drink a lot, pee a lot syndrome.
Okay.
That's the number one. If it gets bad, they'll start losing weight. If it gets really bad, you'll walk into the room and it'll smell like an outhouse because the ammonia in the breath will be so bad. But they're pretty sick by that time usually.
Okay.
But it's the sudden increase in drinking and urinating. Actually, the urinating comes first if you want to do the chicken egg thing. But
okay, and so like if you saw more amounts of, or you saw a bigger clump of litter, for example, that would be a sign.
Yeah, I can tell you what happened with my cat. I had 2 cats, and they had a history. The younger cat had a history of urinary tract infections. But the older one seemed fine. They weren't losing weight. Nothing was happening. And all of a sudden, we went from 2 or 3 clumps of litter in the box every day to 8 or 9. And so naturally, I took the younger cat in first because she was my big ticket item cat. And if anybody was going to be sick, it was going to be her. But she tested fine, and I had just run complete blood work on the older cat, I think in April, because she was in a study. When you're a vet student, every dog is in a study of some kind.
Right.
Spirit had been in a chronic diarrhea study. She just had a full blood workup in April. Everything was perfect. This was July, and she was in kidney failure. So, but she went on another 5 stinking years. She was a tough old broad. She really was. It was early kidney failure, but it was definitely, she wasn't concentrating. She was a little azotemic. So, it can just be overnight like that.
Yeah. Oh, that's
so,
scary.
it's always worth paying attention to what's in the litter box.
Right.
That's your eye on the inner world.
Yeah. I certainly never noticed it when Rags went into chronic renal failure, but I did once they told me to notice it.
Yeah.
Is there, like, one of the things that's often searched for on my site is kidney disease cat food? Is there such a thing other than the prescription diet stuff?
Yeah, there's such a thing. Did you read my article? You did, huh?
Yes, I did.
And it's...
And I'm going to link back to it. This is just to cover broad stuff.
Yeah. The thing about the kidney cat food is the only study that's ever really shown a benefit was funded by the company that made the food.
Okay.
In my experience, those foods, if you start them on those diets too early, you're gonna have problems. When I was in vet school, they said, don't start them on KD until they're 80% kidney function. When you really start to need restricted phosphorus. Because those diets are so low in protein, they don't really give enough protein for ongoing body maintenance. So these cats tend to muscle waste. They get thinner. They don't like it. Now this one study showed, increased length of life and fewer complications. And, that's fine. If you want to do that, my philosophy is that if somebody said to me, Jean, you can live 10 years longer if you just give up the Ben & Jerry's. And I would say, stick your 10 years and pass the ice cream.
Right.
Because, oh God, it's a freaking blizzard out there. I have to go to the store.
Sorry.
It really looks bad. No, I wouldn't have gotten my shit together before now anyway. So, I like to feed them what they will eat, what they enjoy. The higher protein foods also have more fat, so it maintains their body weight better. It just depends. Is it a food-motivated cat? Do they really get a lot of joy out of eating their whatever high-protein food? I just have a problem taking that away from them and making their life longer but more boring and less enjoyable.
Right.
And I'm not, most people wouldn't agree with me, but that's my philosophy.
Okay. Do you want to continue this later so you can get to the store?
No, it's not going to make any difference.
Okay. Well, I didn't want to keep you if that would help. Can you explain in layman's terms what kidney failure means, or like what's the process and what your understanding is of how it makes the cat feel?
Well, the process is that kidney cells die off over time and are replaced with scar tissue. And the kidneys have a huge capacity, and you can lose, by the time you show symptoms, you've lost 75% of your functional tissue. So now you're running, it's like, when you come to the end of the rope, that means there's no more rope.
Right.
And if you keep going, you will fall. So these guys have come to the end of their reserve capacity, and now we have symptoms. And because the kidneys are responsible for retaining water and certain ions and excreting other things, it's very active, metabolically very active tissue. Vitamin D impacts it. It has to do, there's a hormone produced in the kidneys that tells the bone marrow to produce more red blood cells. So when the kidneys are failing, then they get anemic because that signal's not being sent anymore.
Right.
So, what happens is that they drink water, but they can't, or they, take in water. I mean, cats eating wet food take in a whole lot more water than cats eating dry food, but me, and I don't like dry food anyway. Much to my cat's dismay.
Right.
They do love it, but I hate to give it to them.
Yeah.
Except as a treat. And so the kidneys are excreting water like crazy because they can't hold on to it. So then they get thirsty and they drink, but they can never make up for what they're losing. And also you're losing proteins, you're losing kind of important things out in the urine. And so they start to lose weight because they're breaking down their own tissue to try and supply some of the things that the kidneys would have normally held back and recycled. So it's a bad cycle, and when those, so the kidneys are also not excreting ammonia and other toxins, the urea toxins. Well, those now start to build up in the blood. And one time I lived behind a dairy right in the middle of Denver, but there was a dairy, and they had an ammonia leak. And it was 1 o'clock in the morning, and fortunately it was summer. I woke up 1 o'clock in the morning with this, and it was like somebody took an ice pick and shoved it through your eye. It gave me an instantaneous severe headache. To have that ammonia going into my bloodstream. So these guys feel lousy. You know, when you have a headache, you're nauseous. You know, they don't want to eat. The weight loss gets worse. They cannibalize their own tissue to try and maintain themselves, and it's a very, if you don't do anything, it's a very fast downward spiral.
Right.
Now, the thing that I like to do for these guys, now there's all kind of meds nowadays that they use calcitriol and amlodipine and all these things to control the calcium phosphorus balance and to manage the anemia and the other the high blood pressure. These cats tend to become hypertensive, but the one thing that fixes almost everything is subcutaneous fluids. So learn how to give fluids and give them.
Right.
I just had somebody write me this morning, well, I'm giving my cat fluids once a week. It's like, well, yeah, that would be like, if you have chronic pain, you would take an aspirin once a week. Come on, dude.
Yeah.
Pay attention. They need the fluids. And supplementing the fluids does a host of wonderful things, including it dilutes out those toxins and kind of forces them out through the kidneys, and so it brings those levels down. The cat's less dehydrated, because dehydration causes a headache all by itself, and it causes nausea. So, if you can correct the dehydration, you've got 90% of the problem licked. Now, when cats are on a lot of fluids, you have to worry about supplementing potassium. In vet school, I worked at the pharmacy, and every bag of fluids that went out was spiked with potassium. We added extra potassium. Because all those fluids are made for humans, and humans tend to get too much potassium, so all fluids are made with too low of potassium. To make the potassium even normal, you have to add it. So, and I've seen vets say, well, I'd rather supplement orally. Just put it in the damn bag of fluids.
Yeah.
And I am the only vet that I know that does that. Because I work for the pharmacy. Well, the other person who worked for the pharmacy also does. But she's the only other one.
Okay.
Nothing's without complications.
Right. Well, that's interesting about the potassium. I definitely wish that I would have known that when Rags was alive.
Yeah, and it used to be. I mean, there was an issue with this potassium, and it was actually discovered by one of my teachers and one of my professors at vet school. He was Marty Fettman. He was the first veterinarian in space, and was a big deal in those days. Back in the day, not just everyone went up in space, But they found that KD, the food KD, was causing cats to become hypokalemic, which is low potassium, because it just didn't have enough potassium in it to make up for what they lose in the urine. So now KD has more potassium, and I assume all the others do too.
Okay.
I would say if you're going to feed a kidney diet, only feed the wet version. The dry version is just, you're slapping yourself upside the head at the same time you're trying to help,
Yeah.
Because the dry food just sucks the moisture right out of them. So you're gonna lose that one.
Yeah.
So the canned food's extremely important.
Well, my mom's cat has been on kidney food dry for a long time before I took him off dry food altogether, and we didn't put him on a kidney food wet. But that's the one that just went to the vet, or went to the emergency clinic. Oh gosh, what was I gonna ask you? Oh, when Rags was, when I gave him lactator ringers, whatever, it was once a day, and then it became twice a day, because they didn't want they were, I'm not going to be able to say this right, but basically my memory of it was too much in failing, like too much fluid in failing kidneys could really hurt him, so that's why they broke it down to twice a day eventually.
Well, the reason is that there's where you inject it, that just has a poor blood supply and a limited capacity to absorb fluids.
Okay.
So, if you give a 5-pound cat 200 cc's of fluids, it's just going to drain down into his legs, and they can't absorb it.
Okay.
So that you give smaller amounts more frequently. I do not recommend lactated ringers, though. You really need to use something like Normasol or Plasmasol or something, Plasmolite. Ringers has lactic acid in it, and these cats are acidotic. Acid is a big problem, so the last thing you want to do is add more acid. And lactate is lactic acid.
Right. Gene, where were you when Rags was alive?
I was in Colorado.
I could still have him, maybe. Oh. Okay, and then another thing that was added that I had to shoot into the bag was B12.
Uh-huh.
What do you think about?
I usually just put B complex and C and potassium.
Okay. Okay.
Because the bees tend to get washed out. They're water soluble. They tend to get washed out with the fluids. So yeah.
Okay. Oh gosh. I'm one of those people that's not good to know things in hindsight, because then I'll like sit there and be like, what could I have done differently?
I know.
I miss it.
That was part of your path, and it was part of his path.
You're right. And he taught me a lot, so probably wouldn't be having this conversation with you today if it weren't for him.
Yeah, there you go. So now, together, you and I will help a lot of people that wouldn't have otherwise gotten this information.
I definitely hope so. Speaking of that, those were kind of all of my questions. Do you have anything to add to this that maybe I forgot to ask? I might think of things later, but...
I'm just looking over my article to see if there's anything we need to emphasize. Omega-3 fatty acids and probiotics are really, really important for these guys.
Okay. When you say for these guys, you mean kidney failure cats or all cats?
All cats, but especially the kidney failure. Because omega-3s have been shown to improve their status, and so have probiotics. Now, there's a particular brand name of probiotics called Azadil that's been, that's the one they did the studies on.
Okay.
A reader just told me that they can't get it through this link anymore, so I'm going to have to figure out where to go. But I think any probiotic in a storm would be just fine, because the probiotics help. A lot of the uremic toxins are manufactured by the bacteria in the colon, so proteins are broken down there, and I think for some reason, I can't remember what the logic was, that stabilizing and balancing that population, it definitely had a huge beneficial effect in terms of keeping the numbers down. And by keeping the numbers down, what you're doing is you're improving how the cat feels. The numbers are themselves critical. It's just that's how you know.
Okay.
And somebody just wrote me this morning, and I'm going to try and put a forum on this website instead of having 48,000 comments. But because people are starting to give each other advice, and I don't want to get blamed for bad advice.
Right.
But they're like, well, how do I know if the cat's in pain? How will I know when it's time?
Yeah.
And the first thing I will say is you'll know.
Yeah.
Sometimes you'll go to the vet and they'll say, well, this doesn't look good. And every single person I've ever said that said, oh, yeah, I
Yeah.
Every single one. So nobody ever doesn't really know. Kidney failure isn't real painful until you start getting the headaches and the stuff because of the ammonia.
Yeah.
Most of this stuff can be managed, but when they quit grooming and they quit wanting to be petted and they just hide and it's a quality of life issue.
Yeah.
And these guys, most of the dying of kidney disease is pretty horrific. So most of these guys will need a little help.
Yeah.
The other thing is the Feline CRF website has incredibly detailed information, and we refer to each other back and forth all the time. So,
and that's felineCRF.org.
Let me see what it says.
There's a .com too.
FelineCRF.com.
Yeah. .com. Okay.
And they've just got so much information, all the details on all the meds. I'm retired, so I don't have to get into this very often anymore. And, if I was still in practice, would I be using some of these medications like calcitriol and amlodipine? Probably, because I want to make the cat feel better.
Right.
For as long as possible, without going overboard.
Yeah.
I wouldn't recommend a kidney transplant and all that kind of stuff because, why?
Right. Right.
You're going to buy a little time, but in the meantime, you're going to put the cat through this horrific surgery with a long recovery, 2 cats through this surgery and recovery and stuff. For what? For another, 6 months or a year? For some people, that's going to be worth it. That's not my whole philosophy is kind of minimalist, and my cats have taught me that. They've taught me, but they didn't want extraordinary effort.
Right.
When Spirit finally really started to go down, I knew this cat. I had her 20 years, and her attitude was, I would rather die than take a pill every day. It's like, fine.
Yeah.
Then you die. I didn't have a problem putting her down at that point.
Yeah.
She made it abundantly clear that she was ready. We'd had this conversation many times before, and, I was completely cool with that. I was not going to put her through. She didn't want fluids. What I would do was, I had a 60cc syringe, and every once in a while, I would fill it up and walk around the house with it behind my back. And as she was walking across the dining room, I just walk with her and injected it, but I only had the one shot. And it really was only to make me feel better. It didn't make a dang bit of difference to the cat, but
yeah,
that was all she would tolerate. She was a very hands-off kind of cat. She didn't want stuff. She didn't want to be messed with.
Yeah.
So I wasn't going to mess with her. That's not everybody's philosophy.
Yeah.
Had I messed with her, she probably would have lived to be 22, 23 years old.
Yeah.
But she lived with kidney disease for 5 years, with none of that. So, and she did real well right up until the last few days.
Yeah. So, when you said that she said that she didn't want to take a pill every day, do you use an animal communicator?
No, I just knew the cat. I do have an animal communicator that I use, and actually, it was kind of a funny story when the younger cat actually died first, 6 months earlier in December, and I had an animal communicator ask Spirit because these cats have been together for literally 2 lifetimes, and they were just so bonded. And I had her ask Spirit, did she want to go at the same time? And she said, no, I want to feel the sun on my fur again.
Oh.
So the first hot day in June, 6 months later, she said, okay, I'm ready.
Yeah.
I just got it. I got it from her behavior. She communicated it to me, not in words, but she said she was ready. I got it.
Yeah.
And if you're paying attention, you'll get it.
Yeah.
You really will.
I agree. Rags was the first cat that I lost. I mean, my first 2 ragdolls died of FIP, but I was so young I don't really remember it. But he obviously lived 20 years, and I got him when I was 10, so it was a long time for me, like, as far as maturity-wise, and I use an animal communicator, and I don't think I could have made it through that process without it, and the vet, diagnosed him with, like, 2 weeks to live, right before Christmas, and he lived 3 more months, but, I kept asking the animal communicator, is he in pain? I do not want him to be in pain, and he said that the thing that pissed him off the most was that the vet told me 2 weeks because he would decide when he wanted to go, not them.
Yeah, that's for sure. Yeah, especially a strong personality like that,
Yeah. But I agree, like...
And sometimes, sometimes their path takes them through some very unpleasant stuff. And I think that can be... I had a cat, and this is one of the first times I ever got a direct communication from a cat. And it was unbelievable. I went to do a house call euthanasia for this cat, her Siamese cat. Her name was Tsunami. She's a little lynx point Siamese, and they had her out in the there was a little like courtyard, and she was out there, and I'm walking into the courtyard, and she's sitting on the chair, and she looked me right in the eyeballs with her big blue eyes, and she said, "I'm not ready."
Oh.
And she was not ready.
Yeah.
And more Keystone Cops antics occurred, and I finally said, I'm sorry, Carol, I can't do this, and she lived 2 more weeks, and then Carol brought her in to be euthanized, and she said, and I've heard this so many times, these last couple of weeks have been the most amazing.
Yep.
That they've really had some very special experiences in that time. So now when I do euthanasia, I always ask, are you ready? Because I wouldn't say they often say no, but I'd say, it's happened many more times than one. And, and so I have to convey that to the people and say, well, sorry, take her home, because it's, I do like them to tell me. And then again, I have a kitty that I'm working with now, and belongs to an old friend, and I think she could go any time. I think she ought to have gone a couple times, and never. She weighs about 3 pounds, and she looks terrible, but she's still eating. She's got a good app. She's still coming out to get pets, and she's jumping up on the bed, and most of the time she spends in a hidey hole next to a heater, but she's still doing enough normal things that it's like, well, okay.
Yeah.
Yeah. What I should tell you that that around the winter solstice, a lot of animals transition then.
Oh.
The summer and winter solstices especially, and the equinoxes to a lesser degree. But that, I couldn't believe, I actually took the drug log home because the euthanasia solution is a controlled drug, so you have to write it down. And I took the log home to see, is it Saturn, opposite Mars or some horrible thing that's happening? Because I wouldn't have a euthanasia for weeks, and then I'd have 6.
Yeah.
Back to back.
Yeah.
And I was sitting there with the Farmer's Almanac trying to figure all this stuff out, and then I realized it was Christmas, and more than Christmas, it was December 21st.
Wow.
So a lot of animals will transition at those points, and I don't know if the veil is thinner or what kind of woo-woo explanation you want, but I asked the guy that from the crematorium that picked up the bodies. I said, Bob, have you ever noticed this? And he goes, oh yeah. Those
are my busy times of year.
Yeah.
Of course, he's looked into it.
Because he says it's not, it's all the clinics. All of a sudden it's 10 animals or 20 animals, and instead of, the usual 2 or 3 a week.
Yeah.
So he's real busy at those transition times.
Wow. That's fascinating. I love that kind of stuff. I'm glad that you looked into it and shared it.
It was so startling that there was a pattern. It was like so clear. It's like all of a sudden, it wasn't just euthanasia either. It was some cat got out and got hit by a car, and another one suddenly developed a cancer or something. I mean, it's just weird shit.
Yeah.
And all of a sudden they were bailing out one way or another. If I wasn't helping them, they were finding a way on their own.
Yeah. Wow. Kind of scares me, though.
When I'm talking to people around that time of year, I say, just be aware that this could be it, because they like to leave, at the beginning of the winter. If I didn't have to go through a winter, I wouldn't.
Oh, yeah.
If you're old and skinny and arthritic and stuff, I mean, why would you?
Right.
As the door is open.
Right.
Yeah, see ya.
Yeah, that makes sense. Well, that's interesting news. It only scares me because my mom's German Shepherd, he's probably close to... I talked to him through an animal communicator about a year ago and asked him, because a year ago is when my mom's vet suggested, that you put him down when you can't tolerate having to lift him up with a towel anymore. And I asked him, is he ready to go, or if we could find a solution, is he wanting to stay? And he said, yes, find a solution. I want to stay. I still have more work to do, about 2 more years. So it's been a year, and he's not doing so hot. I mean, we don't have to use a towel or anything.
They don't always know or give a correct estimate. I mean,
okay.
They have an ego just like we do, and sometimes they think they can keep going, and they really can't.
Right.
So sometimes you just have to say, well, buddy, I know you said, but I'm the mom here, and I'm going to make the decision. And honestly, I think most animals are fine.
Yeah.
Because they're not so tied to their bodies, and they don't have as much ego hanging on it. And, most of the time I think they're, today, tomorrow, last week, next week, whatever, it's fine.
Yeah.
Especially dogs. They're usually pretty good, like whatever.
Right. They're pretty easygoing. And this guy is a very easygoing guy. It will be a bad loss for our family.
Sometimes, and they think that, I don't feel that bad, and then all of a sudden, a few days later, it's like, oh, wait, I feel like, and they don't always, they might think they can push through it, and they really can't.
Right.
And sometimes you have to explain to them, I know that your spirit is strong, but your body is toast.
Yeah.
And we're gonna let you go. Come back another time.
Yeah.
They will if you let them.
Yeah. Do you get a lot of pushback when you say something like that? Because I believe in reincarnation, but it's my understanding a lot of people don't.
Well, I was always in a holistic clinic, so people were more more open to that kind of thing.
Okay.
And there's some people I wouldn't say that to. If they come in with a 4-foot cross hanging around their neck, I probably wouldn't say that. But but most people, are at least open to life after death, and I say, they're not for the animals. It's like changing socks. It isn't that big of a transition for them, because they're not all wound up in fear and all this crap that we have about it.
Right.
They don't have that. Very few animals are that way. I've known a few.
Yeah.
That were just really bound up in their relationship with their people, and they were really tied to the body. But that's rare.
Yeah.
Most of them, if you make the decision from a place of love, you can't be wrong.
Right. I agree. What animal communicator do you use?
I use Kate Solisti.
Oh, yeah, I know her. I've interviewed her for my blog.
Yeah. We're old friends. She used to, when she first moved back to Colorado, she used to come into the clinic. Even though she was violently allergic to cats, she would come in and kind of volunteer. And some of the stuff she did was just so uncanny. You know, it was totally impossible that she did not hear this from the animal.
Yeah.
Because, I had 2 cats at one point. They weren't eating. One of them had been, was only 6 months old, but she'd had a litter of kittens. They were all dead. And she was pretty traumatized, and I had to pull the last kitten out, and she wouldn't eat.
Yeah.
She was perfectly healthy. There was no reason. And Kate asked her, well, why won't she eat? And she said, well, they pulled my guts out. I know you can't live without guts. Well, and, Kate says, well, check around. They didn't really pull out your guts. Check around again. And so the cat thinks about it. She says, oh yeah. And she started eating like that minute.
Wow.
And the other cat, I had done a dental and pulled all her teeth. They were so rotten. And 99% of the time, I pull those rotten teeth. And these guys, it's like they have a new lease on life, and they're acting like kittens again, and they eat like pigs, and and I had checked her. Her mouth was healing. I didn't see any sign of infection. I couldn't figure it out. And Kate says, well, why aren't you eating? And she says, well, I don't think I will like how food will feel in my mouth without teeth.
Oh.
It's like, oh, geez, how do you get around that one?
Yeah.
So we, and she said, no infection, no pain. She felt just fine. Everything was fine, no problem. She just didn't think she would, not that she'd tried, but
right.
she wasn't willing to try because she didn't think she would like it. This is, of course, it's a calico, because calicos are stubborn. And so I'm thinking, oh my God, what do I do? And I said, oh, Kate, ask her if she'll drink. Could she drink a little half and half? And, as she allows us how she might be willing to drink some half and half. So I lived across the street. I ran home, got my half and half out of the refrigerator, ran back, poured it in the bowl. She drank it.
Wow.
And over the next few days, I was able to add little food to it. And the next day, she finally went back to the shelter and got adopted. And the next time I saw her, she was obese. So she got over it.
Yeah. Oh, that's cute.
It's so much fun. You see all these interesting things happen. Yeah. But that made a believer out of me in terms of the animal communication, because I was like, yeah, okay, I believe we communicate, but can you have a conversation where you say, what's your favorite color?
Right.
And they tell you, that's a little weird. I don't know if I can go there, but it's like after that, it's like, okay, whatever. Yep, you betcha.
The only last thing I had was spirit essences. You mentioned that as, a holistic kind of aspect to, oh my gosh, I need to, my sickness is taking over my brain right now.
Yeah, no, it helps with their mental attitude and their emotions. The graceful aging was a formula that I came up with. Actually, I was teaching a class on flower essences, and one of the gals had a kidney failure cat, and so we put these essences together just for, just to kind of bring her spirits up.
Yeah.
Just to make her feel, mentally okay. Because, when you get all depressed and dragged down. And she said it made an incredible difference for this cat. So,
wow.
So that's, and it really has done wonders for a lot of old animals. It's a really unique formula, and it's really cool,
Yeah.
And I wouldn't have ever even thought of it if it hadn't been for a cat that taught me.
Wow.
And of course, Spirit was my 20-year-old.
Yeah.
So, Spirit Essences was named after my cat. Thank you very much. So,
Yeah, and that's something I've been wondering about just because I'm an entrepreneur at heart. Can I ask you how that whole thing with Jackson Galaxy happened?
Oh, yeah. Well, it was, I had been doing spirit essences on my own I started right out of vet school. I started making my own. And, and I was selling them online. And I had a form, if you wanted to get some, then you had to fill out a form and send me a check, and then I had to go to the post office. And it started pissing me off every time I would get an order, and I thought, well, that isn't the right attitude to have about it. So I took it offline. I took it down. And then a couple of years later, when I met Jackson, I think I stopped in about 2001. And about a year later, I met Jackson, and, and we started Little Big Cat, and I said, because we're trying to figure out how can we make money at this? Because we're both unemployed. It's like, this is our passion. This is what we want to do, but we have to make it viable.
Yeah.
As a business. And I said, well, I do have one thing. I said, I have these essences. I said, but you would have to do all the work. I said, I'm willing to revive it, but you have to do all of it. I'm not going to make them. I'm not, I'll come up with the ideas for formulas. That's the fun part.
Right.
But make them and package them and go to the post office and mail. I said, I'm not doing any of that. And he said, sure, I'll do it. And, so he gradually took over all of that, and I sold my interest to him a number of years ago when I developed congestive heart failure and I really couldn't work.
Yeah.
And so he said he would take over, and I said, you betcha. More than happy to give it to you, dude.
Well, that's neat. I didn't know about your...
He's done really well with it. I mean, it's been a great thing, and I'm happy they're still out there. And and we still talk about it, and I said Reiki to him and stuff, and it's all good. But he's done really well with it. I'm very proud of him.
Yeah.
And I've thought, I still like to keep my hand in, and then I think, well, what could I do? And then I think I would have to work, and that's the end of that idea. Because I've thought about making different essences, like for kids or something, for something completely not to do with it, but I just don't want to.
Yeah.
I have formulated things for other people, but I just know myself. If it comes down to physical work, I'm gonna hate it.
Right.
I like to just sit around and have ideas.
Yeah.
Good ideas. Execution, I'm not so hot at that.
I understand that because I have plenty of ideas, and I'm like, if I could just finish executing the ones I have.
I know, because I have a good idea. I actually had an astrologer tell me. She says, well, you have Aries moon, and that's Aries is all about starting new things and getting all jazzed and excited. And then she says, then you have Saturn in the something goes and sits on Aries. And it's true. I just got to get going, and I'm having a great time. And then all of a sudden, it's like I come up to a brick wall and I stop.
Yeah.
For a particular reason. But apparently that's the particular reason.
Gotcha. That's funny that you mentioned an astrologer, because I go to one too every year for my birthday. But I've always had Leo cats.
Really?
Yeah, Charlie and Trig were on purpose Leos, but I wanted their birthdays to be Leo, but Rags was a Leo, and then we got Camus and Murphy not even thinking about it, and they're both Leos. And then I actually found Charlie and Trig weren't really on purpose, actually, because I found Charlie. I wanted a relative of Rags, so I was watching one of the breeders' websites that had a relative of Rags, and I saw his little picture, and I was like, oh my gosh, and he was born July 23rd, so the first thing I do is go and look it up to make sure it's a Leo. And it's like right on the cusp, I think, but I think that's interesting. Have you ever had a trend with your cats and their
Well,
astrological signs?
I have 2 Geminis and 2 Leos right now.
Okay.
And I'm a Scorpio, so it makes no sense at all.
No. I'm a Taurus, and Scorpios are supposed to like my honesty, and the only reason I know that is because my dad's a Scorpio, and that's what I've been told.
Yeah, Scorpios and Tauruses get... Jackson is a Taurus.
So he is?
We get along so well.
And where did you meet Jackson?
At Kate Celesti's house.
Oh, okay.
Yeah. At the time we were having these kind of monthly meetings, we called it CARE, Companion Animal Resource something. And so it would be all the, the dog sitters and the trainers, and we had a couple of vets and several animal communicators. It was all the animal people in the Boulder area. And Jackson was working for Boulder Humane Society at the time. And I had just moved back to Colorado from California, and for 6 months everybody said, "You have to meet Jackson Galaxy. You guys would just get along so well. He's the cat guy at the Boulder Humane Society." And of course, for 6 months, everybody has been telling him, "You have to meet Dr. Dean. Oh my God, she's this cat person." And it's and we finally met. And out of my mouth come the words, "We have important work to do together." And I'm thinking, I don't even know this guy. What the hell did I say that for? I don't know. What the hell? And, it turned out we did. We had really important work to do together.
Yeah.
So every once in a while I get real prophetic, but it's scary. It's like sometimes my mouth gets me in places that I don't want to go.
Yeah. Well, so then he moved out to L.A. when My Cat from Hell came about, or what?
Oh, no, he moved out to L.A. He met a woman out there and fell in love, and so he moved in with her. And but he has a Master of Fine Arts. He was an actor and musician and stuff before he did any of this cat stuff. But he knows how to work in that business. So I guess he met some people, and he wanted to, make something of this. So,
yeah, that makes sense.
And they talked to some people that had worked with the Cesar Millan thing, and they were like, "Oh yeah, we'll do that," and and it was years, but finally, Animal Planet picked it up. So
that's so fun. Okay, well, I think that's it. You don't have any vet friends in Kansas City, do you?
Randy Kidd, I think, is the only one that I know in Kansas City. I don't know if he's still in practice.
Okay.
KIDD.
Okay.
He's a holistic guy, and so whoever he sold his practice to might be. But he's a really great guy.
Okay. I've never heard of him, so maybe he's not, but I'm definitely going to look him up.
Yeah.
And then my other thought in the process of doing this interview conversation was, would you be up for doing this monthly or bi-weekly? Because I think it could be really beneficial to the readers. Like, I know a reader specifically going through cat disease or kidney failure right now with her 15-year-old ragdoll.
Yeah.
So, was wondering if you'd be... I mean, I know it doesn't take as long... I mean, it takes a long time because we've been on the phone for an hour, but maybe not as long as typing it all up.
Yeah. Now, have you heard of Fiverr.com?
Yeah.
You can get people to transcribe for, 20 minutes for $5. So, $15 you can get somebody else to at least type you up a draft.
Yeah. Hey, that's a good idea. I use it for like graphic images a lot, but that's a really good idea. I'll probably do this one myself, but
Yeah. But you know what we could do if we got our shit together a little bit?
I don't want you to work.
Well, we could do like a podcast.
Oh, yeah.
And then you could put it on your website, put it on my website, and we'd both get more exposure.
Yes, I like that idea.
This is all about promoting each other and getting us in a situation where we can actually make a living doing all of this fun stuff that we love to do.
Right. Well, yeah, because unfortunately my first goal with Floppycats was because I wanted to know more. It wasn't to make money, but now I'm like, I want to do this all the time.
Exactly. And this is mostly what I do. I do consulting for a few places, but this is what I want to do, and so I want to be able to make a living doing this.
Yeah.
So I'm trying to think of, podcasts don't pay anything, but once we have some subscribers to a podcast and the newsletters and the blogs and stuff, then we could do a webinar.
Right.
And a webinar, you can charge $10 to come to the webinar. Well, who wouldn't do that? Or you have a free webinar, but then you sell products at the end. Like I could sell my ebooks or something.
Right.
It's just coming up with products that people would want to buy. That's the hard part.
Yeah.
I don't want to do any work.
Right.
But to me, writing isn't working, so that works out very well.
Oh, good.
Because I'm happy to write stuff. I just don't, want to make flower essences or do things that I have to really work hard.
Right.
Because writing for me is fun. That's not work.
Yeah. I tried the spirit essences on my cats, the Peacemaker, because I have 2 cats. They're both 2 years old, and then my mom has 2 cats that are 7 years old, and once a year they are put in the same house together because my parents have a lake house and we go down there for Thanksgiving. And when my cats were young, I was very good about taking them over to my parents' house on a regular basis so that everybody knew each other and but they hadn't seen each other for a long time because I wasn't putting flea control on my cats, and I was letting them outside, and my mom doesn't let her cats outside, so I didn't want them to be, I didn't want my mom's cats to get fleas, so I stopped it, and I tried the Peacemaker, and I did everything I was told to do, but it didn't, they were almost worse, and I don't blame it on the spirit essences, but I couldn't do a product review and, cut it down, so I just feel like I look bad in Jackson Galaxy's eyes.
Oh, don't worry about that. No, he don't care. What I would say is, for one thing, Peacemaker is for a situation where the cats have an established pattern.
Okay.
What you do when you're just going for a weekend is you put them in another room, and you don't let them out.
Yeah.
They'll live.
Yeah.
Because it takes weeks to introduce new cats.
Right.
Weeks. You're not gonna do it on Thanksgiving weekend. You might try travel remedy or whatever the travel remedy is called these days.
Rescue remedy?
No, it's not. No, Jackson has something.
Oh, your version of it.
Yeah.
Okay.
Well, it's because it's rescue remedies for crisis situations, not really for. It is for more general.
Okay.
Things. I forget what he calls it. Traveling something or changing or something. To make the transition in and out
a
little easier for him. But for a short-term situation, I wouldn't even try and introduce them. That's just silly.
Yeah. Well, it ended up they were fine after a day and a half. But
that's remarkable.
Well, that's only because I talked to all of them a lot. I'm like, thank you for letting your friends come over. So I always think that might help. But anyway, okay, well, I am really excited about this. I will think about the podcast and see, what I can come up with. And if you come up with anything, please let me know.
Well, because we can do that. We can do stuff like this on Skype or one of the conference calls. I have a free account at a couple of the conference call places, and they record it.
Okay.
Because this with the speakerphone and stuff, it wouldn't be good enough quality.
Right.
for a podcast.
Right.
But there's Skype and there's all these other venues that we could use instead.
Okay. Well, and I was also thinking it might be interesting to, come up with a topic like kidney disease in cats, ask readers for questions, and then do the podcast based on those questions, too.
Oh, that's a great idea, too, yeah.
Okay, well,
Yeah.
gosh,
If
this
I
makes...
can get the forum working on Little Big Cat, I think we'll get some good ideas from that, too.
Okay.
Because I just checked my site stats, and we have 25,000 people a month coming to that website. So, then the big things that people, the number one article is constipation.
Really?
The number one search term.
Wow.
So that's something that we should think about, for sure.
Okay. I have almost 40 a month, and it's anemia in cats, which is kidney disease, right?
Yeah.
That's my number one search term. When my lab...
Kidney disease is up there, but I tell you, constipation in these little cats, and sometimes it goes hand in hand with the kidney stuff because it makes them dehydrated, and dehydration causes constipation.
Right.
So, but the diseases of older cats, I'm in the baby boomer generation, and, we're getting older, our cats are getting older, and, everything's falling apart, for God's sake.
Yeah. Okay, well, then maybe constipation in cats would be the first podcast.
Yeah, I think it would be a really good one. In fact, I decided my next ebook is going to be about cat poop. Because cat owners get so wound up about cat poop. And you know what? For the most part, it just isn't that worth stressing about, But people don't know that. So,
what do you mean that it's
bring
gross?
people's minds to rest about cat poop. Oh my God, that would save so much stress in the world. Wars would stop. There would be peace.
What do you mean, like, they get stressed out about, like, because of the smell of it, or just...
Oh, the smell, or, it flops over the side of the box onto the carpet, or it's loose one day and dry the next day, or, people get so, oh my goodness, it was different today, oh my God. It's like, yeah, are you always the same? I mean, geez, dude.
Yeah.
Mostly I want people to relax about it, but I want people to know when they should worry.
Right.
And when they should not. And this is, when you get any group of cat owners together, eventually the conversation will devolve to poop.
That's so funny.
Always. It's you could write a check on it. It's so reliable. So.
That's funny, because I don't really pay much attention to it other than when it's diarrhea, and that scares me. But the other day, I was thinking about it because I was always into Dr. Oz when he was on Oprah.
Yeah.
I don't really watch him now, but how you're supposed to have an S shape when you go to the bathroom, and one of my cats had like a perfect S, and I'm like, this is awesome.
I know. I do that too, because I do tape his show, and I skim through it, and he's all about poop, and it's like, yeah, this is what you need to know, but if it's not an S shape, it may not be a problem.
Right. Right.
And if it's an S, if it's not, if it's a little loose for a week, oh well, they were processing a virus through their guts, or the weather changed, or
Yeah.
It's the GI system, very sensitive to all kinds of influences. So, I just don't because people just freak completely out.
That's funny. Do you feed your cats raw food?
Yes. I feed them a lot of canned right these days because I just haven't had the impetus to make a giant batch of... I get like 40 pounds of chicken and process it.
Oh, okay.
And I just haven't been able to do that.
Yeah.
For a while. So I am going to Whole Foods today. I'll get them turkey and make their food, but they get a little bit of raw every day.
Okay.
And then some canned.
And what kind of can do you get?
Oh, I get all kinds. Let's see, what are they?
Is there any kind, I guess, that you don't like?
Well, the really Science Diet I don't like.
Okay.
Periodically I go to PetSmart or something. I buy one of everything.
Yeah.
And I conduct experiments. Just like every once in a while I do, go through different kinds of kitty litter just to see what's out there and how it works, just so I know what to tell people.
Yeah.
So I was in this, we were testing all these foods, and I opened up the Science Diet, and it smelled so foul. It's like, oh, this is really, I couldn't even give it to the dog. I mean, it was like, this is so grotesque.
Yeah.
I put it right into the garbage disposal. It's so overpriced for what it is, and it's, but, there's the whole byproducts and all that stuff. If the cat was eating a mouse or a rat or a rabbit, it would be eating the byproducts too. It's just when you feed only byproducts, like only Friskies or only Fancy Feast, that's a problem. But an occasional can of Friskies or Fancy Feast, I don't have a problem with that.
Okay.
I tell people avoid fish and no dry food. Those are my big rules.
Yeah. I took both of my cats to the acupuncturist that Tucker goes to, my mom's dog, and she told me that Trig, one of my cats, is has a lot of heat in him, so she wants him on cold meat, like venison. I think venison is rabbit. So chicken is...
Those aren't the cold meats. Chicken is actually one of the cooler ones. I have that somewhere. Email me and remind me, because I'm going to have to get going here.
Okay.
It did stop snowing, though.
Oh, good.
It was just for that few minutes. It was like solid white curtain out there. It was like, but that's, Colorado, wait 5 minutes.
Right. My sister's in Boulder. Okay, well, thank you so much for your time. And I'll email you about the cold meats thing, too.
Yeah, because I'll have to dig that up. But I have a whole chart somewhere.
Okay. Well, awesome. Thank you so much again, and I will be in touch shortly. Hopefully I can do the transcription over the weekend.
Okay, perfect.
All right. Have a good day.
You too.
Bye.